So for today's deep dive, we're looking at WaterHealth International. This is a company that saw the global water crisis. I mean, the fact that 2.1 billion people still lack safe drinking water.
It's a staggering number.
It is. And they basically decided the whole approach to fixing it was fundamentally broken. Our mission is to really unpack how they proved that selling safe water can actually be financially sustainable.
It's a fantastic case study. It really blends social purpose with a market-based model. WA started back in 1995, and it was really born from two things: Trey Lance Addy's vision and this huge technological breakthrough.
And that breakthrough was the ultraviolet waterworks device, the UVW, right? Came out of Lawrence Berkeley National Lab.
Exactly. Developed by Dr. Ashok Gadgil. It was incredibly effective, could disinfect water for just cents per ton. But, the first version they built was completely impractical.
How so?
It's a fascinating lesson. The initial unit was actually too efficient. It was too big, too expensive, and needed way too much power for the places they wanted to help.
So they had to pivot early.
A huge pivot. Gadgil's team went back and re-engineered it into this tiny unit. It weighed about 7 kilograms, and, this is the key, it could run off a simple car battery. That one change made the whole decentralized strategy possible.
Okay, so they have this portable, low-power tech. How do you turn that into a business? What did that look like on the ground?
That became the WaterHealth Center, or the WHC.
The WHC.
Right. It's basically a small modular purification kiosk. Think maybe 55 square meters. And one of these can serve a community of around 10,000 people.
And inside they're using that UV tech.
That plus other filters. Sometimes they even add reverse osmosis if the local water has specific contaminants like, say, arsenic. The end product always meets WHO quality standards.
Now, this is where it gets really interesting for me, the hybrid finance model.
Yeah.
I mean, building one of these centers can cost up to $90,000.
Yeah.
How do you finance that in a low-income community?
They cracked the code. The strategy is pretty brilliant. Grant-funded CapEx, user-funded OpEx.
Okay, break that down.
So the upfront capital costs, the CapEx, are all covered by impact investors, like the IFC or Acumen Fund, and also corporate grants.
Like that big Coca-Cola and Diageo partnership in Africa.
Exactly. That was a $6 million fund for their Safe Water for Africa project. But then the operating costs, the OpEx, staff salaries, filters, electricity, all of that is covered by selling the water.
At a very low price point, I assume.
Oh, absolutely. In India, it was something like 5 to 7 rupees for a 20-liter container. It's affordable, but it's enough. Most centers would hit their operational break-even point in just 4 to 6 months.
Wow, that quick. And that's what let them scale. They launched big in India, right? Over 300 centers by 2008.
They did. Then expanded into Ghana and Nigeria. By the mid-2010s, they were serving around 5 million people. But of course, that kind of growth comes with huge challenges.
So what was the biggest initial hurdle? Was it the tech, the money, or something else?
It was behavioral. Convincing people to pay for water when they've always gotten it for free from a river or, even if it was dangerous, it was a massive undertaking.
Yeah. So you're not just selling water, you're selling trust.
You're selling trust and health. They created a whole nonprofit arm, the Jaltara Foundation, just to do community education, what they call behavior change communication, to get that buy-in.
And what about, infrastructure challenges, power outages, droughts?
They had to be incredibly nimble. In Ghana, the power grid was unreliable, so they started retrofitting the centers with solar panels to guarantee they'd stay open.
Smart.
And in India, when local wells ran dry in the summer, they didn't just close up shop. They actually paid to truck in water to their centers to keep the supply going. It cost them more, but it maintained that community trust.
And the last piece is always regulatory, right? Dealing with governments, state monopolies.
For sure. In some places, like Nigeria, the state water authority saw them as competition. So WHI had to adapt its messaging. They positioned themselves not as a competitor, but as a complementary service filling the gaps the government couldn't.
Securing those long-term contracts like the 25-year ones in Ghana must have been key.
It was. It legitimized their role and turned the government into a partner instead of an obstacle.
So when you pull it all together, WHI's success really seems to prove that decentralized solutions can work. But only if you have this powerful partnership between public, private, and community sectors.
Absolutely. And it leaves you with a really provocative thought. Given how agile and self-sufficient these small local water health centers are, what would happen if governments took all that money they spend on massive, slow, centralized pipeline projects and just redirected it entirely into thousands of rapidly deployable decentralized solutions like this one?
A total paradigm shift. It shows you that maybe you don't need a mega project to solve a mega problem. Maybe what you really need is just a better model, something for you all to think about.
Thank you for listening to Mission Possible, innovating for the world's most marginalized. This podcast is built on the outstanding work of our students, whose curiosity and commitment drive much of the research and storytelling you hear. Each episode is grounded in academic research and shaped through close collaboration with our partners. To learn more about the research and partnerships behind this podcast, feel free to contact us. Thank you for joining.